Best way to deal with a narcissist. Techniques. Dealing with a narcissist, whether in personal or professional relationships, can be an emotionally draining and challenging experience. Narcissistic individuals often exhibit manipulation, lack of empathy, and a sense of entitlement, which can lead to criticism, aggression, and even domestic violence in extreme cases. Living with a narcissist or being in a relationship with one can be particularly taxing, as their behavior frequently revolves around rage and an inability to accept feedback or criticism. This article explores the best way to deal with a narcissist, focusing on non-duality techniques and strategies for maintaining boundaries, self-care, and support systems. It also discusses when it may be necessary to disengage from or completely end a relationship with a narcissist, and how to respond effectively to their manipulative behaviors. Understanding narcissistic personalities. Recognizing the signs of narcissistic personality disorder, NPD, having narcissistic tendencies, such as bragging or making oneself the center of attention, is normal when they occur occasionally. However, narcissistic personality disorder, NPD, is different. The symptoms are more severe, occur across different situations and environments, and make relationships with others challenging, if not impossible. The acronym Special Me can help remember the 9 signs of NPD. Sense of self-importance. Preoccupation with power, beauty, or success. Entitled. Can only be around people who are important or special. Interpersonally exploitative for their own gain. Arrogant. Lack empathy. Must be admired. Envious of others or believe that others are envious of them. Trained mental health professionals conduct structured interviews to learn more about an individual's typical behavior patterns. If someone consistently displays at least 5 of the special ME traits, they meet the diagnostic criteria for NPD. Exploring the different types of narcissism. Narcissism exists on a spectrum, and there are 8 different types identified by Dr. Ramani Durvasula. Grandiose. The classic or stereotypical narcissist, often described as arrogant, entitled, charming, grandiose, superficial, and vain. Covert vulnerable. Characterized by a lack of empathy, entitlement, hypersensitivity, passive-aggressive behavior, resentment, insecurity, and low self-esteem. Malignon. The most toxic and aversive type, with an exploitative, antagonistic, Machiavellian, and sometimes psychopathic overlay. Communal. Wholly engaged in the community and constantly posting about their charitable deeds on social media, seeking validation and admiration. Neglectful. Do not engage with anyone unless they want something from them, treating people as conveniences rather than individuals. Benign. Exhibit a lack of empathy, entitlement, and grandiosity, but in a more clueless, clumsy, and childlike manner. Entitled. Reflects the widespread sense of entitlement seen in society today, which is often taught rather than an innate trait. Generational cultural. A type that is difficult to describe and may not necessarily be considered narcissism due to the universality of histories. Distinguishing narcissistic traits from clinical NPD. Narcissism refers to a sense of self-importance and exists on a spectrum, ranging from healthy narcissism, a positive sense of self associated with prosocial behaviors, to pathological narcissism, characterized by authoritarianism, envy, grandiosity, shallowness, and a deficit of empathy and remorse. Narcissistic personality disorder, NPD, is a formal condition listed in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5-TR. To receive an NPD diagnosis, a mental health professional must determine if an individual experiences at least 5 of the 9 formal symptoms across different situations and persistently for more than 6 months. The key difference between possessing narcissistic traits and meeting a full NPD diagnosis is that individuals with NPD may not accept responsibility for their behaviors, while those with narcissistic traits may be able to recognize and take ownership when hurting people they care about. Additionally, NPD symptoms must manifest across most areas of a person's life and remain stable over time, whereas narcissistic traits may only appear in certain contexts or at times. Strategies for coping and boundary setting. Building self-esteem and resilience. Dealing with a narcissist can be emotionally draining and damaging to one's self-esteem. To cope effectively, it's crucial to build resilience and prioritize self-care practices. Here are some strategies. Engage in positive self-talk and affirmations to counteract the narcissist's criticism and devaluation. Seek support from trusted friends and family members who can provide a reality check and emotional validation. Practice self-care activities that promote emotional well-being, such as exercise, meditation, or engaging in hobbies you enjoy. Consider seeking professional help from a therapist experienced in dealing with narcissistic abuse to gain a clearer perspective and develop coping mechanisms. Created by Elias Stasinos. If you found value in this video, please subscribe, like, share, and comment.